This morning at Senate estimates, Brendan Murphy, the Secretary of the Federal Health Department, has confirmed that mass vaccination clinics will be established around the country. Joining us live is Dr Andrew Miller. He's the WA Australian Medical Association President. Andrew Miller, this news just coming through. What would that look like, do you think? Overseas, I know we've seen convention centres, football fields taken over for vaccination purposes. Is that the sort of thing we should be doing here?
Yes, Ash, once we get into the broader part of the population beyond 1B, we will need to have every boot on the ground as far as vaccination provision is concerned. So you can imagine community halls, the places we go to vote, those sort of areas being used to just get the public through in as big a number as possible.
GPs have been venting their frustrations over the vaccine rollout. How is that 1B phase rollout progressing here in Australia in your view? It seems to be a huge success or a total shambles, depending on who you speak with.
Yes, well, I think the answer to that probably is that we'll get there. We do need to have the tap turned on fully with vaccine supply, and hopefully the local provision of the AstraZeneca vaccine will do that. But there's just drips coming out at the moment, and that's causing frustration because people are trying to make appointments that GPs can't fulfil if they don't have the vaccine in their fridge. So we really need that supply ramped up from all directions, the locally made AstraZeneca, as well as the hopefully more Pfizer deliveries coming from overseas.
Yeah, you mentioned that AstraZeneca vaccine. We did see an interesting statement from the US regulators overnight about the AstraZeneca vaccine. Help us decode that. It does seem to raise concerns about the trial's data. Do we need to be concerned here about some of these reports? I mean, here in Australia, Professor Skerritt, for one, doesn't seem to be worried.
No, well, I think unfortunately have a record of not being as straightforward in their data release and to spin in a marketing sense. And that really doesn't help in this situation. We just want the facts and we just want to know exactly what the results show. There's a suggestion that they'd mixed some old data with the current data in the announcement from the US government, and we'll wait and see what that says. It's not talking to the vaccine, it's more about how effective it is. We do have concerns how effective it's going to be, particularly against the variant known as the South African variant, but we also will need to look at a vaccine that adapts to all sorts of variants over time. So it may just be that we need top-ups, but we look forward to some clarification. And yet again, it seems to be needs to clarify their data, unfortunately.
Overseas, we're seeing a lot of studies looking at different areas of just how the vaccine is working, but also how coronavirus is continuing to spread. In Belgium, there's been a real focus on COVID spreading rapidly in schools. What sort of lessons should we be learning from their experience?
Well, we know that the early narrative around COVID not being a problem for children and that it not spreading in schools is untrue. And they're seeing in Belgium that around 48% of their current ICU cases are things that are related to people having caught it from school children. So it's very informative for us as we talk about the possibilities of reopening in the future as to how we would respond if we did see an outbreak of a variant before we're all fully vaccinated with an effective vaccine against variants. We need to remember that schools need proper ventilation, and we need to protect our teachers and our students there with airborne PPE. And we need to just keep a very close eye on what happens to children because, of course, they're the ones who will carry the longest burden of disease if they do get COVID infection.
And how far are we off from vaccinating our kids? Are you suggesting that essentially until that happens, until we have mass vaccination of children, that life just can't get back to normal?
Well, I don't think anyone would think it was a good idea to risk the country's children. Any politician that went down that path would be taking a very big political risk. Nobody wants to see sick children, even if that's in a much lower number than you see amongst the elderly with this particular disease. We don't know what the long-term effects are, although it's not looking good for a lot of children overseas who have had the disease. So, no, we won't be allowing coronavirus to ravage our under-16s in Australia. I'm sure we'll protect them with vaccination before we open up to any risk of community transmission. And there is work underway to get vaccines approved for children. There's no reason to expect that won't be achievable, and that we'll see that rolling out later this year or early next year into our kids. But of course, we're going to protect the kids before we open up to any risk.
Because the more we learn about long COVID, the more worrying it is.
Well, what we know with this disease is it's very different to influenza and to many other viruses in that it affects most systems in the body. It causes nasty effects in the lung, of course, but also in the brain, the heart, the reproductive system. And so these are all uncharted territory, and we're seeing some disturbing reports of long-term problems. And until we understand a lot more about that, of course, we don't want to risk infection in anyone, let alone in our children who have many years ahead of them. So we'll continue to look at that closely and make sure that we don't encourage the idea that this is a safe disease for children. It's not a safe disease for anybody.
Dr. Andrew Miller, always appreciate you joining us. Thank you.
Great to talk to you.